Good day to all. துயரர் ஆய்வு கேஸ் டிஸ்கஷன் நம்பர் 2. இந்த வீடியோ வந்து இங்கிலீஷில் இருக்க போகுது மேக்ஸிமம். This video is going to be in English as requested by most of the doctors from North India. The case discussion will be in English for their convenience and for their learning. So this video is all about dengue hemorrhagic fever, critical stage of dengue hemorrhagic fever. This patient was having fever for past 10 days and he was admitted since 3 days in an allopathic hospital, big hospital, multi-specialty hospital. But there is no improvement, there is no even reduction in fever. So the temperature is more than 100 to 101. So in this condition, the parents were decided to shift the patient to our hospital. He is the first patient who came in ambulance with oxygen support, because that was his condition when he was discharged from the allopathic hospital. His SpO2 was varying from 89 to 91, so he was brought in an ambulance with oxygen support. He was in great pathological condition, like urine albumin was 3+, ascites, pleural effusion with fever, and he was found to be CRP nearly 350 CRP level, typhoid mildly positive, dengue IgG positive. Even though IgG is positive, his platelet was reducing to 80,000. With all these pathological names, the parents were in great dilemma whether to continue in allopathic hospital or to shift to homeopathy, because the fear will be there. It is a life and death situation. So they asked me to talk to the duty doctor over there. He was also threatening me that the patient in very critical condition, he wants to be shifted to ICU because capillary effusion is happening in the lungs. So alveolar hemorrhage is there. CT reveals alveolar hemorrhage. So in such condition, I gave hope to the patient's attender, parents, to shift them to homeopathic hospital, to our hospital. This is not a blind belief. சிலர் நினைக்கலாம் ரொம்ப குருட்டுத்தனமாக இந்த டாக்டர் வந்து இந்த கேஸ்லாம் பார்க்குறாருன்னு. பட் எக்ஸ்பீரியன்ஸ் விச் ஐ கெயின்ட் ஓவர் 13+ years has given me confidence to take up this case in our homeopathic hospital. As Hanuman says, there are no diseases but only sick people. Before he entered our hospital, we don't know whether he is Naxomica or Lycopodium or Phosphorus or Pulsatilla or Stramonium. But we know these drugs very well. He should be one among our usually using homeopathic remedies. So, hearing all these pathological words, ascites, pleural effusion, ARDS, we should not get panic to take up such cases. So this is going to be a very good clinical discussion. The case details will be narrated by Sindha Rose now.
Hi, I'm Dr. Nadu. I'm here to give a brief about the case. So he was a 17-year-old male was presented with a complaint of fever for nearly a week. He also had symptoms of body pain, headache, and lower abdominal pain. He also had breathing difficulty and along with dry cough, and his cough it was aggravating on the basis of deep inspiration as well as while he talks. So these were the basic symptoms which he had. Like sir said, he was on allopathic medications along with fluids and antibiotics. But then there was no proper improvement. The disease was actually in a progressing state. It was rapidly progressing. He ended up in ascites, pleural effusion, alveolar hemorrhage, and there was splenomegaly too. And this patient had a past history of dengue fever in 2017. Even that time he went into dengue shock syndrome, even during his first attack. So later on what happened is he was brought to a hospital on 29th April like around night something, and then same like what all symptoms which I mentioned before. He had all such symptoms, and his main concern was breathing difficulty. He was brought to the hospital with oxygen support. So when he was brought to the hospital, his SpO2 was around 89 to 91. So was given with oxygen support, and then his platelet was around 90,000 when he was brought to the hospital. CRP level was 236. So he was given oxygen support. So we was monitoring like with oxygen and without oxygen in order to know the variation of the improvement. So later on, his temperature was around 101 on 29th, and then medicines were started along with oxygen therapy, and oral hydration therapy was also given as there should not be any dehydration. And then so next day his temperature came down to 99, and patient was also stable, he was well oriented too, and his pulse rate also came down to normal like around 80. And then when he was brought to the hospital, he had abdominal breathing. We have done an examination, respiratory examination. So we found out that it was pleural rub, bilateral, and abdominal breathing was there. Fluid and examination of abdomen, he had fluid thrill. So that was positive for ascites too. So for in case of oxygen, first on 29th it was we started with him with 6 units of O2 support, and then gradually we reduced to 4 units. So without oxygen it was 92%, and with oxygen it was 95%. Then again on 30/4/2023 it was it was reduced to 2 units. So with oxygen was 95 and without was 94 to 95. So there was improvement. And again same with the 2 units, it was next day like 1/5/23. It was with oxygen was 98%, without also was like 97 to 98%. So he was stable, he was able to breathe normally without oxygen also. So there was a withdrawal of oxygen support. His abdominal breathing also has come down. And his temperature was also reduced to 99. So we kept on monitoring him with vitals, and his CBC also was rechecked, and in case of platelet count, there was also improvement in platelet and CRP count. So like for platelet count, it was on 29th I said it was on 90,000, and then on 30 it was 1,18,000. Again on May 1st it was 1,47,000. Again May 4th it was 3,67,000. So there was a gradual improvement in platelet count, as well as symptomatic relief was there. And like during the time of admission, we have again checked his we have taken HRCT and USG abdomen. So on 2/5/2023, so his HRCT showed that there was a reduce of pleural effusion. There was only mild pleural effusion. In the beginning it was bilateral, very high pleural effusion was there, and there was alveolar hemorrhage, and there was no alveolar hemorrhage after the medications too, and there was no ascites. There was only hepatosplenomegaly was present, mild hepatosplenomegaly, and patient never had any appetite too, but his urine and stool sleep was others were normal. So later on there was an improved in appetite. So as he gained all the symptomatic, as there was symptomatic relief, so then the patient was discharged on May 5th, and he was given with a follow-up of after 1 week, and medicines was also given at the present condition in case for the hepatosplenomegaly too. So this is the short gist about the case. And next Dr. Amrita Rashmi will tell about the dengue pathological conditions.
Now, what is this dengue? Dengue is a viral disease. It is caused by dengue virus. There are actually 4 subtypes of dengue virus. Dengue virus 1, 2, 3 and 4. Infection with any of this one of the subtypes of dengue fever gives lifelong immunity for this specific subtype. So this means what? You can get reinfection with any other types of dengue. So if you get infection with dengue 1 for the first time, you may have protection from dengue 1 for the next time, but you can get infection with dengue 2, 3 or 4. So how is this dengue transmitted? It is transmitted through a mosquito called Aedes aegypti. The incubation period is usually from 3 to 14 days. And what is this incubation period? Incubation period, this is the time gap between the bite of the infected mosquito and the onset of symptoms. What happens? What is the pathogenesis behind this dengue fever? So first attack of dengue fever. After the bite of the infected mosquito, the virus replicates in the nearby lymph nodes. And from the lymph nodes, this virus goes into the lymphatic system. And from the lymphatic system, it goes into the bloodstream. And this is the stage of viremia. In the whole blood, the virus will be formed. And from this blood, it goes to the reticuloendothelial system, and this virus replicates in the reticuloendothelial system. And from the reticuloendothelial system, it goes to other organs also. But the subsequent attack of dengue fever causes a main pathogenesis. It is called as increased vascular permeability. There will be capillary leakage, and there will be leakage of plasma from the blood into the organs and tissues, causing pleural effusion and ascites. 90% of the dengue hemorrhagic fever and dengue shock syndrome occur during the subsequent infection. But our patient, during the first infection, that is during 2017 itself, he had dengue shock syndrome, which is very unusual. Clinical features. Coming to the clinical features, there are 3 stages. The first is the febrile stage, second is the critical phase, and third is the recovery or the convalescent phase. Now coming to the febrile phase. It lasts for 2 to 7 days, and as we all know, it is found with common symptoms of dengue such as high grade of fever associated with headache, retroorbital pain, myalgia, arthralgia, etc. Almost most of the patients recover from this stage. Only some patients go to the next stage called the critical phase, and our patient was in this critical stage when he got admitted to a hospital. After 7 days of the fever, the vascular permeability slowly gets increased. When the vascular permeability gets increased, the plasma leakage starts happening. This plasma gets accumulated in organs, especially in the lungs, causing pleural effusion, and in abdomen, causing ascites. As the plasma leakage increases, there will be hemoconcentration. Hemoconcentration increases and albumin leakage starts, so there will be hypoalbuminemia. And in urine, protein loss will be happening, and our patient had 3+ albumin in urine, and his serum globulin and serum albumin levels were also reduced. So this is the stage where it goes into complications. There are 2 main complications of dengue fever. One is dengue hemorrhagic fever, which is also called as DHF, and dengue shock syndrome, DSS. This dengue hemorrhagic fever, there is a World Health Organization criteria for the diagnosis of dengue hemorrhagic fever. What is this criteria? The first is fever or a recent history of fever which has lasted for 2 to 7 days. And the second criteria is any hemorrhagic manifestation, and our patient had alveolar hemorrhage. And thrombocytopenia, that is decrease in platelet count. And evidence of increased vascular permeability. And what is this increased vascular permeability evidence? Our patient had ascites and pleural effusion. So in this condition, the hematocrit and the platelet count should be monitored every 24 hours. And our patient, we also monitored these conditions every 24 hours. And the APTT values and the prothrombin time will be increased, and our patient also had increase in APTT and PT values. And this is the critical stage where rehydration is very much necessary, and we ensured oral rehydration for our patient. This dengue hemorrhagic fever progresses, if it progresses, it goes into dengue shock syndrome, where multiple organ failure occurs, and it is a very fatal condition. Almost the fatality rate of this dengue hemorrhagic fever or dengue shock syndrome is 44%. After homeopathic medications, that is Icimelimum, his symptoms improved and his overall condition improved, and we discharged him with the above criteria. The criteria for discharge of dengue hemorrhagic patients, these are the criteria. Absence of fever for at least 24 hours. Absence of fever for at least 24 hours without the use of anti-fever medications. The second is the return of appetite, and our patient had return of appetite. Third is visible clinical improvement. Our patient's symptoms were all better. And the fourth is good urine output. We were also monitoring his urine output every 24 hours. And minimum of 3 days recovery after dengue shock syndrome. Our patient has not gone into shock because we were monitoring him continuously. Especially his BP was monitored continuously. No respiratory distress from pleural effusion or ascites. His pleural effusion also reduced and ascites also reduced. And his platelet count was increasing. Actually, the discharge criteria for the discharge, platelet count must be at least more than 50,000. But our patient's platelet count was increased. So we discharged him based on this criteria. So how we came to the Icimelimum and how we treated him, sir will discuss.
Having hearing all pathological grave words like ascites, pleural effusion, ARDS, and multiple organ failure, this is the challenge to keep all these pathological words aside, and we should evaluate, observe, and analyze this patient. On observation itself, I came to a remedy. He was not ready to answer any questions. He was very angry and he doesn't answer any questions. He is a gym boy and he was about to go for this competition next month. So this was a big shock for him that his body got affected. So on this, I have selected the rubric intolerance of ailments, first one. And on observation, I found he is not answering. So rubric here comes is mind answering, refusing to answer. In Boric, the rubric is mind, mood, disposition, taciturn, disinclined to be disturbed or answer questions. In Kent, anger, irascibility when obliged to answer. Aversion, dislikes to answer in Pathak. On seeing all these rubrics, I came to a remedy, Naxomica. I told my fellow mates that he is Naxomica and came out of the room. But I want to confirm it again because he is in a very critical stage. So I sent two of my duty doctors to take up his case alone. So there also he was not answering, but only one thing he was saying that I was getting ready for the competition, bodybuilding competition, but now the condition is he cannot go for that. His body got damaged. How will I go for the competition? Now the thing is, only concern of him is his body got damaged. So here applying the rubric fear invalid. So he was getting ready for a competition and he was about to climb the stage. In this condition, he was shocked that he was affected with the dengue hemorrhagic fever. So analyzing this rubric, fear invalid, Ignatia is the remedy. So Naxomica and Ignatia comes under the same family, Loganaceae. But here the confusion starts whether to give Naxomica or Ignatia. And aversion to answer, another remedy comes to our mind is Arnica. But Arnica will go into next step that he will just close the eyes and turn the face when we ask the question. Arnica comes under the Compositae family. So shock, based on shock, you are shocked by his ailments. Three family comes there. As per Rajan Sankaram, 3 family comes there. Loganaceae, Compositae and Ranunculaceae. But here Loganaceae dominates. But whether to give Naxomica or Ignatia as the first remedy. Having going through this chart of plant families and miasm Sankaran schema, in Loganaceae, now he comes under the typhoid miasm. Why typhoid miasm? Crisis, intense, sinking, subacute, emergency, critical period, collapse, demanding, impatience. All these keywords is apt for him. So under typhoid miasm in Loganaceae family, the only remedy is Naxomica. So arriving the remedy, just with observation I have come to Naxomica, but on deep analysis I have confirmed this, yes, this is Naxomica. I have selected the remedy and it was given in 1M potency because his energy level is good. So for every 1 hour once, since it's acute case, we are giving Naxomica 1. The whole night he was monitored by our team of doctors. Oxygen level was dropping, picking up, dropping, and it was not static because of this alveolar hemorrhage. And in 48 hours, he was brought out of this oxygen support. His temperature was also normal with Naxomica 1. Once he got cured, his symptoms were better. He got attitude problem, which will question and touch the ego of the doctors also. But as a doctors, we should have a balance between the emotion and mind. So I have convinced the doctors team, because whenever we go for rounds, he won't answer. Instead, he used to play PUBG. He used to converse in the phone. So this will definitely irritate our doctors, because 48 hours back he was in very critical state, losing our sleep, losing our appetite. We were taking care of him. But now scenario has changed. But this should be converted into rubric rather than showing our egotism. Right? Egotism should not be shown back. So analyzing now the presenting complaint was SpO2 normal, temperature normal, but he still has pleural effusion, ascites, hepatomegaly, splenomegaly. So we have to address those problems. So now the state of medicine, state of mind should also be changed. Naxomica complementary medicine sulfur can be given blindly, but we didn't give blindly. As I said, he was very egoistic and his self-esteem was high. We took the rubric ardent, delusion of abundance. He has everything. He don't want to talk to us. He knows everything. That was his attitude. Delusion is a great person, haughty, egotism, self-esteem, ailments from egotism. In BBCR, one rubric is there: proud, arrogance, self-esteem, haughty. In Murphy, egotism, general, excessive, self-esteem. Having all these rubrics, we have come to the remedy, sulfur. There is no respect to the doctors over there. In Sankaran's method, it comes to column 16 and row 3. He is proud about his identity. I am proud to be me and I know better than you. So this correctly matched his attitude. In row 3, the keywords which was apt for him is my choice, ego, image. And in column 6, neglectful. So with Naxomica and sulfur, actually without seeing the patient in person, we cannot come to this Naxomica and sulfur in any form, because with observation we have come to the remedy. Whether we choose classical or any other method, Segal, Rajan Sakaran method, whatever it is, we have to apply it very wisely and come to a conclusion that this remedy works. After he was admitted on 29th night, 29th Saturday, 8 p.m. He got discharged Thursday. So just with 4 days, 5 days, this dengue hemorrhagic fever with so-called grave pathology was cured by these remedies. Why we are posting these videos is that it should gain confidence, and with experience you people gain, the young homeopaths. You should also be capable of handling such cases with grave pathology. Concluding this video, the parents were very much thankful to us. They came to our consultation room and gave sweet boxes and presented with a big memento praising all our activities. And the patient is also has become very normal, and he is also thankful now. So the state of mind changes every 2 days or 3 days when in sick. So we have to go through it, and we have come to the remedy. இந்த 2 நாள், அதாவது சனி இரவு, ஞாயிற்றுக்கிழமை இரவு, Saturday night and Sunday night, our RMO was taking care of him very carefully. So I have to introduce Dr. Naveen now. Naveen sir, வாங்க, உங்கள் எக்ஸ்பீரியன்ஸ் சொல்லிட்டு போங்க. அப்படியே பிகைண்ட் த ஸ்க்ரீனே உட்காந்துப்பார் நவீன், ஆனால் அவர் தான் எல்லாமே. வாங்க. ஓகே, இஸ் டாக்டர் நவீன், RMO சாந்தம் ஹாஸ்பிட்டல் ரிசர்ச் சென்டர். இந்த வீடியோ எடிட் பண்ணுறது ஆளுநர் அழகுராஜா இவர் தான். இப்போ அவருடைய எக்ஸ்பீரியன்ஸ் ஷேர் பண்ணுவார்.
ஆக்சுவலி என்னன்னா, அந்த பேஷண்ட் வந்துட்டு நைட்டு ஒரு 10 o'clock தான் அட்மிட் ஆகிருப்பார். அப்போ வந்து ஆக்சிஜன் ஃபஸ்ட்டு செக் பண்ணப்போ 89 இருந்துச்சு. பட் வித் ஆக்சிஜனோட தான் வந்திருந்தார். 89 தான் இருந்துச்சு. நாங்கள் வந்து வித்தவுட் செக் பண்ணியிருந்தோம். அப்போவுமே வந்துட்டு ரொம்ப இம்ப்ரூவ்மெண்ட் இல்லை. 4 யூனிட் அண்ட் 5 யூனிட் வந்து ரைஸ் பண்ணி பார்த்துட்டே இருந்தோம். அப்போ ஒரு 96 வந்துச்சு SpO2. தென் வந்துட்டு நைட்டு சடனாக வந்துட்டு ஆக்சிஜன் இன்னும் லோ ஆக ஆரம்பிச்சிச்சு. 89 போச்சு. வித் ஆக்சிஜன், வித்தவுட் ஆக்சிஜன் 82 to 85 இருந்துச்சு. சாருக்கு வந்துட்டு இன்ஃபார்ம் பண்ணியிருந்தோம். அப்போ வந்துட்டு நைட்டு ஆக்சிஜன் வந்து இன்னும் யூனிட் வந்துட்டு ரைஸ் பண்ண சொன்னார். செக் பண்ணோம். திரும்ப அப்போ வந்து ஃபீவர் இருந்துச்சு. மிட் நைட்டு ஓவர் நைட் தூங்கலை. பேஷண்ட்டோட அட்டெண்டர் வந்துட்டு ஃபீவர் இருக்குது, இன்னும் ஆக்சிஜன் வந்துட்டு இம்ப்ரூவ் ஆகலை அப்படின்னு சொல்லிட்டு இருந்தாங்க. தென் வந்து மார்னிங் வந்துட்டு சடனாக ஃபீவர் வந்துட்டு கம்மியாச்சு. பட் பேஷண்ட் வந்து ஸ்டேபிளாக தான் இருந்தார். 48 ஹவர்ஸில் ஆக்சிஜனை வந்து எடுத்துட்டோம், ரிமூவ் பண்ணிட்டோம்.
நவீன் இப்படி தான் பிகைண்ட் த ஸ்க்ரீன் நிறைய ஒர்க் பண்ணுவார். ஆன் ஸ்க்ரீன் அவர் கொஞ்சம் சைட் டைப். ஓகே, நெக்ஸ்ட் வீடியோ இதே மாதிரி ஒரு த்ரில்லிங்கான வீடியோவில் ஹோமியோபதி கியூட் கேஸோட சந்திப்போம். தேங்க்யூ. அப்படி போயிட்டு
நிஜமாவே நாங்க ரொம்ப நீங்க கொடுத்த நம்பிக்கையில மட்டும் அதை வந்துமே நாங்க ரொம்ப 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 சந்தோஷம் எங்களுக்கு. ரொம்ப சந்தோஷம். அஜுமா இந்த படிவா
Thank you.